Hello everyone, and welcome to LPN 114, Chapter 4, The Nursing Process, Critical Thinking and Decision Making. So the nursing process is a decision-making framework to determine the needs of clients. And throughout that nursing process, we utilize critical thinking skills, skillful reasoning, and logical thoughts to determine our actions. And we always want to think purposefully. So that means we want to avoid jumping to conclusions and avoid making decisions based on assumptions. But rather, we need to validate or ensure the correctness of the information that we obtain to make good decisions. As we learned in pharmacology, the steps of the nursing process. So this should be a reinforcement of your learning. The first step in the nursing process is assessment, and that entails interviewing the patient and the family, the actual physical assessment, utilizing the assessment skills that we've been learning, including auscultation, palpation, percussion, and using our senses like we've talked about, such as the sense of smell, the sense of sight, to visually observe and inspect what we see, and then also reviewing laboratory and diagnostic tests. The second step is diagnosis, which is an analysis of the assessment information gathered. And remember, we've talked about how this cannot be a medical diagnosis, such as stroke or chronic fatigue, but rather a nursing diagnosis that is taken out of our NANDA-approved nursing diagnoses, maybe something such as impaired mobility. And then the third step in the nursing process is planning, which is determining the priorities that we're going to put in place for our patient. The implementation phase is when you put your plan into action, carrying out the nursing interventions. And then evaluation is reflecting on the interventions that you've carried out and continually evaluating and reevaluating what is working for the patient, what they're accomplishing, and what they still need to accomplish as their goal. And this is just a diagram showing the steps of the nursing process and how it's interconnected with the patient, and the nurse is continuously using critical thinking skills and the decision-making process to set new goals for the patient. And this slide is just referring to the role of the RN and the LPN in regards to the nursing process. And those roles are determined by the American Nurses Association, or ANA, Standards of Practice, and the National Federation of Licensed Practical Nurses. So now we're going to talk a little bit more in depth about each one of the steps of the nursing process, and hopefully this is all going to make sense since you've already heard it once in pharmacology. But the first part of the nursing process is assessment, which includes subjective and objective data. And remember, subjective is what the person reports. Maybe they feel depressed. Maybe they're complaining of nausea or blurry vision and any kind of pain. Whereas objective is what we see as the nurse, and we may see them grimacing, and that might give us an indication that they're in pain. Or we may see them guarding their abdominal area, and that may give us an indication that they have abdominal pain. When you're interviewing the patient, you want to establish a rapport with the patient, kind of creating a relationship of mutual trust and understanding. And one way you can do that is to introduce yourself and explain what your role is in the patient's care. Also, you can tell them the purpose of the interview and let them know approximately how long that will take. And the primary and secondary data that they're referring to here is that primary data is anything that the patient tells you, that the patient reports. So, for example, anything that says client reports, client complains, client verbalizes. This is all primary information. It came from the patient. Secondary data is information that comes from another source, maybe from their spouse or another family member. And then another source of secondary data is the patient's chart. You might gather information from the chart. And then the physical assessment portion of the assessment, remember, is all objective information. So the inspection, palpation, auscultation, and percussion. Remember the use of senses to obtain objective data. That's on page 49 of your book. The use of vision, hearing, smell, and touch. And it'd be a good idea to read those things over in box 4.2 in your textbook. But some of the examples used are use of vision to read the results of lab, x-ray, or diagnostic reports. Also to observe the measured volume of urine or drainage in a graduated container, the volume of fluid remaining in the IV bag, or the amount of liquid that has been drunk from a cup with graduated markings. With the use of hearing, we note the sounds heard on auscultation. The use of smell, we detect body or bodily fluid related odors. We talked about having the fruity breath with a diabetic, or the foul smell associated with an infection in the urine. And then the use of touch, we assess pulse rate, detect the temperature of the patient's skin, detect the moisture of the patient's skin, detect the texture of hair, skin, or nails. So those are just a few of them from box 4.2, but make sure you read through all of those. An inspection is when we visually examine the body for rashes, breaks in the skin, normal appearance of the eyes, ears, nose, throat, mouth, limbs. Palpation is touching or feeling the torso and limbs for pulses, lumps, temperature, moisture, and vibrations. Auscultation is listening for abnormal sounds in the lungs, heart, or bowels. And percussion is using the tapping movements that we've talked about to detect abnormalities of the internal organs. So the nursing diagnosis, as you know, is uniquely specific to nurses. Doctors, nurse practitioners, they all use medical diagnoses, but nurses use nursing diagnoses because they want to determine a statement for a problem that the patient is experiencing as a result of their medical diagnosis. And then the nurse wants to use interventions to improve the patient's ability to function as normally as possible. And the nursing diagnoses need to be prioritized. They address physical, psychosocial, and environmental needs of the patients. And the book used an example of ineffective airway clearance as opposed to chronic low self-esteem, stating that both are important, but the first one has to be addressed before the second one can be addressed. And that's all based on Maslow's hierarchy of human needs. And I'm sure many of you have seen Maslow's hierarchy of needs in your prerequisite classes. But essentially, it's in ascending order of importance. And the first level at the bottom, which is on the next slide here, addresses the physiologic needs or those that a person needs to survive. The next one is safety and security needs. And the third one is the need for love and belonging, followed by self-esteem and feelings of self-worth. And then the need for learning and exploring. And then aesthetic needs for beauty and order. And finally, the seventh one addresses the need for self-actualization, which is the need for reaching one's own growth potential. So that's what we want to base our nursing diagnoses or prioritize our nursing diagnoses on, is Maslow's hierarchy of needs. And we select our nursing diagnoses from the North American Nursing Diagnosis Association, or NANDA, and the I at the end there, I believe, is international lists. And all of you should have purchased your nursing diagnoses book, and all of those are the NANDA approved nursing diagnoses. When determining nursing diagnoses, you'll want to look at the defining characteristics. In other words, the signs and symptoms that the patient is exhibiting or experiencing. And the example in the book talks about a patient who has a diagnosis of pneumonia. And they talk about some of the nursing diagnoses that would be appropriate for that patient would be related to breathing, ventilation, and gas exchange, and possibly even immobility. But what you'll do is you'll look to see what kinds of signs and symptoms they have. Then you'll go to your NANDA approved book and look at their medical diagnosis, and you'll see a list of associated nursing diagnosis or typical associated nursing diagnosis. One example of a defining characteristic is, say, for example, of edema of the legs that causes perfusion. So edema is the medical diagnosis, but it causes perfusion, which is fluid in an organ or a tissue. So it causes perfusion, and so they might be at risk for injury. So we can talk more about that on Monday when we have our nursing diagnosis meeting at 10 a.m., and that will hopefully become much more clear. When you're writing a nursing diagnosis, it includes three parts: the problem, etiology, and signs and symptoms. So the problem is the diagnostic concept or label based on the patient's needs. The etiology is what's causing the problem. It's connected to the diagnostic label by the words related to. And then the signs and symptoms include the data collected and the evidence used to support the diagnostic label. And they are linked to the statement with the words as evidenced by. So each nursing diagnosis will be listed as the problem, related to what it's caused by, as evidenced by the signs and symptoms, or how you know what you see, what you hear. Okay, and we'll be working on those on Monday in class. And this is Maslow's hierarchy of human needs, and I talked a little bit about this already in a previous slide, but again, just at the very bottom, it starts at the bottom, it's in ascending order. It's the physiological needs, what a human needs to survive. So their heart rhythm has to be regular and stable in order for them to think about doing something more complex. So the lower level needs have to be addressed before any teaching or learning can occur. So an example of that might be if the person is in pain, if they have to go to the bathroom, if they're too hot, if they're nauseous, if they're hungry. All those things need to be addressed before a patient can be taught and actively learn something, right? We can't really learn something if we have to run to the bathroom. All we can think about is we got to get to the bathroom, then we can learn. And it's the same way with everyone. The lower level needs need to be addressed before proceeding. Okay, and then the planning portion of the nursing process. There are long-term goals and short-term goals. With the nursing goal, it's the overall direction that they want the patient to progress, to improve. But long-term goals are not expected to be met before the patient is discharged from the hospital. So, in other words, it's an ongoing process of improvement. Short-term goals are expected to be met by the time the patient is discharged or transferred to a different level of care. And that might include something such as a short teaching intervention. And then expected outcomes. You'll see on your nursing care plan paper, there is a column for expected outcomes. So those are statements of measurable action for the patient within a specific time frame and in response to nursing interventions. So some of the things the outcome statements should include are a realistic, specific action to be taken by the patient, an action that the patient is willing and able to perform, an action that is measurable, and then a definitive time frame in which you'd like the action to occur. Okay, so far we've talked about assessment, diagnosis, and planning. Remember the acronym ADPI: assessment, diagnosis, planning, and now implementation. Implementation part of the nursing process. There are different types of nursing interventions. They talk here about direct or indirect patient care. Direct patient care is when the nurse interacts with the patient directly, such as with bathing, teaching, listening, medication administration. Whereas indirect patient care is when the nurse provides assistance in a setting other than with the client. So in other words, they're still working for the client, but they're doing things like maybe documenting or taking new orders on the patient from the doctor, but it's not directly with the patient. And then there's independent, dependent, and collaborative nursing interventions. So dependent requires an order from the healthcare provider to be carried out. Independent is without consulting any other healthcare professional. And collaborative involves working with other healthcare professionals. And you'll see in your book that the examples they use for independent dependent and collaborative interventions. An independent intervention that doesn't need a doctor's order might be if you notice that their urine is really dark, and so you just decide to go ahead and monitor intake and output on the patient so that you can determine if there's a fluid imbalance. And then dependent intervention example would be if the patient seems constipated and the nurse might order administer laxatives or stool softeners as ordered by the physician. And then when they're referring to individualized nursing interventions, they're saying that the interventions clearly state what needs to be provided to that particular patient and when. For an example, maybe give a 6-ounce protein shake daily at 10 a.m. And so it's nice to individualize the care plans and not have them be a cookie cutter intervention. And then also your book talks about initial implementation steps and ending implementation steps. And those are on page 57 and 58. And some examples of the initial implementation steps might include checking the healthcare provider's order. Let's see here, gathering supplies and equipment, washing your hands, obtaining assistance if needed, identifying your patient with 2 identifiers, obtaining assistance if needed, introducing yourself to the patient. So it's kind of along those lines of those CNA beginning tasks, but make sure you read through those and familiarize or refamiliarize yourself with those. And then the ending implementation steps, of course, include things like evaluating the patient's response to the procedure, make sure they're safe and comfortable and in proper alignment, performing hand hygiene, ask the patient if they need anything and make sure their call light is within reach, and documenting your interventions and their effectiveness. So what type of nursing intervention requires a healthcare provider's orders before they can be performed? And that answer is dependent. This type of nursing intervention requires a healthcare provider's order before they can be performed. And then the final step of the nursing process is evaluation. So you want to make sure, are the nursing diagnoses correct? Have you established goals that are both realistic and reachable? Have you decided on the correct order of priorities? And have you selected and implemented the correct specific interventions? And then has the patient's condition changed at all? Can they be measured? And can they be done within a certain time frame? Then the types of nursing care plans are outlined in your book on chapter 59 and 60. Computerized care plans are the standard in most hospitals, and they utilize the standardized language for nursing diagnoses, or NANDA, outcomes, NOC, and NIC interventions for the computerized care. And then there's standardized care plans. Those are usually pre-printed with nursing diagnoses and corresponding interventions, choices to coordinate with a particular diagnosis. So they coordinate nursing problems with medical diagnoses. And then there's a multidisciplinary care plan that also is used in the hospital. And the nice thing about that is on the actual care plan, they have a space not only for nurses, but they have it for other disciplines such as respiratory therapy, social work, physical therapy, and dietitians. And so the big advantage with the multidisciplinary care plan is that there's communication and collaboration among disciplines. And then critical pathways, also called clinical pathways, It's like a standardized care plan, except they're based on the progression expected for each day the patient is in the hospital. It uses the average length of stay for the particular medical diagnosis as the basis for progression of care. And then student care plans. There's a little article or a little paragraph in your book about student care plans. And the reason we have you complete care plans is because it allows you to make that connection between the patient's medical diagnosis, medications, lab and diagnostic tests, assessment data, nursing diagnoses, nursing orders or interventions, and evaluations. So it's kind of collaborating all of those things. And to sum it up, it helps you to think like a nurse. So, which type of nursing care plan provides daily nursing interventions that change as the patient improves? And that answer is the critical pathway, also called clinical pathways. These care plans are similar to standardized care plans, except they're based on the progression for each day the patient is in the hospital. These next couple of slides talk about what you need to do to prepare to care for your patients prior to your clinical experience. So be sure to read through this in your book as well. It starts on page 60 and I believe goes to about page 67. But if your patient is having a procedure, you want to research the procedure. You'll want to come up with potential nursing diagnoses associated with that procedure and that particular illness. You'll want to come up with expected outcomes and to develop your interventions. And you're going to go and you're going to meet and assess the patient. And in future semesters, what we do is we have the students go to the clinical site the night before and meet their patient and look through their chart and learn all about the patient. Go home. You might be expected to prepare a partial care plan before returning the next day to care for the patient. And then you'll want to evaluate your nursing diagnosis, implement your interventions, and evaluate your care plan. With the expected outcomes, your book does a nice job showing some examples, and that's on page 65. Is expected outcomes for each nursing diagnosis could be similar to the following. It states, patient will rate chest pain at 0 to 2 before discharge. Patient will ambulate 30 feet in the hallway without chest pain before discharge. Patient will verbalize what to expect during and after the coronary arteriography by noon tomorrow. So those are all expected outcomes. And with the expected outcomes, again, you want to make sure they're realistic, specific action, again, measurable within a definitive time frame. And then step 4 on the previous slide, when it says to develop your interventions, make sure that you're performing those tasks before your interventions that we talked about earlier, and similar to the beginning tasks, and then afterwards make sure you're completing the completion tasks that we talked about earlier. And then with the implementation of your interventions on step 7, make sure that your interventions are within the scope of practice according to the Nurse Practice Act. So make sure it's something that you can do as the nurse. The last slide here is referring to concept maps, also called mind maps. But the concept maps help to see relationships between the nursing diagnosis and the assessment data. This is not something we use in the LPN program, but the important thing to know about the concept map is that it follows along with the nursing process, and it can be used to organize the care plan. So again, helps you to see the relationship between nursing diagnoses and assessment data.